Welcome to Topic Time. In this topic time, we discuss about testing of disinfectants. Such tests are used to detect the efficiency of disinfectants. Name of such tests are phenol coefficient test, which is otherwise known as Rydell-Walker test. Second test is Chick-Martin test. Third one is capacity test, which is otherwise known as Kelsey-Sykes test. And the last one is in-use test, which is otherwise known as Kelsey-Maurer test, out of which the first and most important one is phenol coefficient test, which is otherwise known as Rydell-Walker test. This is a comparative test. Here, comparison is done with phenol, that is, the efficiency of the disinfectant is compared with the efficiency of phenol. And what efficiency is tested? The disinfective power is tested here. That is, the disinfective power to kill Salmonella typhi is detected here. That is, the disinfection power of the given disinfectant is compared with the disinfectant power of phenol. That is, phenol is a standard here, and the efficiency of phenol is compared with the efficiency of the disinfectant under question. The efficiency comparison can be done by using the following equation. That is how we determine the Rydell-Walker coefficient. The Rydell-Walker coefficient gives us an idea about the efficiency of disinfectant fluid. And the equation is Rydell-Walker coefficient is equal to reciprocal of dilution of disinfectant which sterilize Salmonella typhi divided by reciprocal of dilution of phenol which sterilize Salmonella typhi. And while we do the test, the time allotted for sterilization should be equal. That is, equal time shall be given for the disinfectant under question and phenol. After the test, the dilutions are noted and applied in this equation. For example, the dilution of disinfectant under question is 1/450, and the dilution of the phenol is 1/90. That is, after doing the test, we have found that 1/450 dilution of disinfectant can sterilize Salmonella typhi within the allotted time, and 1/90 dilution of phenol can disinfect the Salmonella typhi in the allotted time. Now we have to find the reciprocal of both. Reciprocal of 1/450 is equal to 450, and the reciprocal of 1/90 is equal to 90. Now apply these values in the equation. Then the equation will be like this. Rydell-Walker coefficient is equal to 450 divided by 90. That is, 450 is the dilution of the disinfectant divided by 90 is the dilution of the phenol, which is needed to sterilize Salmonella typhi. Then Rydell-Walker coefficient of the given sample of disinfectant is equal to 450 divided by 90, which is equal to 5. And with such values, how we determine the efficiency? That is, values of the Rydell-Walker coefficient help us to determine the efficiency of the given disinfectant fluid. If the Rydell-Walker coefficient is greater than 1, the given disinfectant is more effective than phenol. If the Rydell-Walker coefficient of a disinfectant is equal to 1, then the power of the disinfectant is equal to the power of the phenol. And if the Rydell-Walker coefficient is less than 1, the disinfectant is less effective than phenol. Here is the disadvantage of Rydell-Walker test. Suppose we have tested a disinfectant by using Rydell-Walker test, and we found the Rydell-Walker coefficient. With that value, we can say whether the disinfectant is powerful or not. But these values are not reliable when natural contaminants or organic contaminants are present in the area of actual disinfection. That is, we are performing the test in the laboratory, and that value is not reliable when we do the disinfection in actual practice, because during the actual practice there may be some natural contaminants or organic contaminants in the area of disinfection. If there is such contaminants in the area of disinfection, the Rydell-Walker value is not a reliable one. To overcome this, we have developed another test, namely Chick-Martin test. And this is a modification of a Rydell-Walker test. This modification eliminates the disadvantage of Rydell-Walker test. That is, Rydell-Walker test cannot predict the disinfection power if there is natural or organic contaminants. But the Chick-Martin test uses dried yeast, fecal material, etc. while testing in the laboratory. Due to the addition of such natural materials, the value will be more accurate. By using that values, we can predict the disinfection power even in the actual practice. That is, this test uses natural materials which simulate the actual disinfection condition. That is, the actual condition of the disinfectant area is simulated in the laboratory by adding dried yeast or feces in the test procedure. Next test to find the disinfection power is capacity test. This is otherwise known as Kelsey-Sykes test. This test determines the following. First one is, which is the appropriate dilution of the disinfectant to disinfect a particular area. And the second one is, by this test, the capacity of a disinfectant to retain its activity even when it is used repeatedly. That is, the capacity of the disinfectant can be determined by using Kelsey-Sykes test. That means we can predict whether the disinfectant loses its ability when it is used repeatedly for disinfection. Capacity test, otherwise Kelsey-Sykes test, can be done by the following method. Here we do not do a comparison with phenol. Here the disinfection power of the given sample of disinfectant is checked. How we check? We check the growth or no growth of microbes on the culture media. If we find any growth on the culture media, then we can say the disinfectant is less powerful. And if there is no growth on the culture media, we can say the disinfectant is more powerful. During the procedure, we use both clean and dirty conditions. Due to this, we can predict the effectiveness of the disinfectant both in clean condition and in the presence of an organic material. And the final test is in-use test, otherwise known as Kelsey-Maurer test. As the name suggests, it is used to find the effectiveness of disinfection in actual practice. That is, for example, if we use a disinfectant in the hospital disinfection process, the in-use tests accurately predict the effectiveness in such disinfection. This test is not performed in the laboratory, but is conducted on the site of actual disinfection, so that practical applicability of the values is increased. By this test, the duration of disinfection needed for a disinfectant can also be detected. That is, how much time is needed for a disinfectant for attaining the disinfection. This time can be calculated. And what is the method of Kelsey-Maurer test? That is in-use test. Here we determine the ability of the disinfectant. What ability? The ability to kill given number of pathogenic Staphylococci bacteria. And where we conduct the test? The test is conducted in the actual area of disinfection. That is, it is not in the laboratory but in the actual surface where practically we have to do the disinfection. While doing the test, we allowed a stipulated time for the disinfection. In that time interval, the ability of the disinfectant to disinfect the pathogenic Staphylococci is determined. The test is conducted. This test is conducted on the area of actual disinfection, so that the values are more accurate. When compared with the phenol coefficient test, in-use test is more accurate.